Hi everyone. I'm Alaska Man and I want to talk to you a wee bit about America's healthcare. First off, what does America's healthcare system look like? America's healthcare system is a combination of public and private providers. There are public programs in place such as the Affordable Care Act, Medicaid, Medicare and the like, but most Americans get their insurance privately through their employers. Despite having insurance, many Americans still pay out of pocket for medical care. Even a trip to the ER can be expensive. That leads us to wonder, is America's healthcare system effective? Let's look at a quick comparison.
In 2017, it's estimated that Canada spent around 10.4% of its GDP on healthcare. By comparison, the United States is estimated to have spent about 17.2% of its GDP that year. The OECD estimates that Canada spent around $4,500 USD per person in 2017. In the United States, though, the figure is expected to be at least double that, at $10,000 per person.
As we saw, America pays more money per capita than any other first world country for healthcare. If we watch this video some more, we will see that we also have the lowest quality of healthcare compared to those other countries. It's clear that there is still much to be desired. But how do America's citizens feel about their health care? Let's listen to a segment from an NPR News podcast to learn more.
Americans are divided on lots of issues, but a new survey from Public Agenda and USA Today shows that people agree across partisan lines that the U.S. healthcare system needs fixing. 92% of respondents say changes are needed, with a majority of Republicans and Democrats interested in seeing major changes or a complete overhaul.
You know, we have the most expensive healthcare in the world in America.
We need to fix the system. It's the system that's broken, it's not the people.
As much as we Americans argue and debate, we at least agree on one thing: our healthcare system needs to change. But that begs the question, how can we fix it? Here are 3 proposals that could help lower the cost and increase the quality of healthcare in America. First up is the idea to establish socialized medicine in America. This is favored more by liberal politicians, and many of them point to Canada as a prime example. There are many other countries that do this, but Canada is a more relevant example because it is so close. A universal coverage healthcare system provides equal care to all citizens at little to no cost for most medical needs. This is because it is a publicly funded program. The drawback of this, however, is that taxes would need to be raised in order to fund something this large, another topic of debate that we won't touch on right now. That leads us to the next proposal, creating a consumer choice-based healthcare system. This is more favored by conservatives, and it revolves around the idea of creating competition between insurance providers. This would promote lower prices and higher quality, while also allowing smaller companies a chance to compete. The overall competition would allow consumers more options in what provider they choose. In addition, it would not require higher taxes on American citizens. This proposal would be difficult to implement into America, however, because it requires large companies to cooperate and give up their monopolies on the market. The third idea I will discuss is reformation. There are many people who believe the best course of action is to reform already existing programs and policies in America. Some point to the Affordable Care Act, while others push for general reforms such as investing in disease control and enforcing price transparency. Building off of already existing programs will mitigate wasted effort in creating change, but not everyone agrees on what can be done. There are also few concrete plans on what specifically to change. I shared 3 current suggestions to improve America's healthcare situation, but there are many, many more out there. So go do your own research and find out more for yourself. Here's a list of the sources I used. But anyways, thanks for watching and I hope you've learned something of worth from